I'm honored to stand here before this gathering to accept this prestigious Global Goalkeepers Award. This award is not only encouraging but also inspiring for many reasons. Foremost, the Gates Foundation, in addition to being an important player in the global health agenda, has continued to be a valuable partner to Tanzania. Secondly, this award is a recognition of the collective leadership and commitment by Tanzanian people who work tirelessly to improve the lives and livelihoods of women, children, and families in Tanzania. So we thank you very much. Ladies and gentlemen, reducing maternal, newborn, child, and adolescent mortality and improving nutrition has been at the core of our national development agenda. As a head of state who also happens to be a mother, investment in maternal health is something that is very dear to me. This is why, upon assuming this high office, I pledge that in addition to investing in health facilities and staff, we would prioritize maternal and child health. Since 2021, we have undertaken various measures to improve reproductive, maternal, newborn, child, and adolescent health, as well as nutrition. It is encouraging to note that due to various strategic interventions, maternal mortality ratio has declined, as it has been said here, but also under 5 mortality has declined as well from 67 to 43% per 1,000, 63 to 43 per 1,000 births. And in our quest to improve reproductive, maternal, newborn, child, and adolescent health, as well as nutrition, together with what has been, together with the measures that has been explained by the panelists and probably the minister, allow me to add my voice on what has been done and what should we do to put the health agenda at the top of our national policy. Firstly, we have increased the number of registered medical specialists, obstetrics and gynecologists from 69 in 2020 to 338 in 2024. Secondly, we have been offering free maternal and under 5 health services. We have also strengthened the referral systems by producing 727 ambulances in 9 years from 2015 to 2024, thereby enhancing access to emergency obstetric care by bridging the gap between rural communities and health facilities, and ensuring timely intervention of the life-threatening cases. To complement the referral system, we have introduced the Mama Emergency Obstetric and Newborn Care Referral Services. Furthermore, we have, and this is done, was done or is done, together with the Vodacom Foundation. Furthermore, we have increased the number of ultrasound oral sonographic machines from 345 in 2020 to 970 in 2024. But for the hard-to-reach areas, the government has taken massive construction of the rural roads to ease in the trips to and from the health centers. Fourthly, we have leveraged on advancement of ICT to conduct countrywide maternal and perinatal death reviews virtually, and the result of which is the realization that competence in managing some of the obstetric complication is a challenge in about 80% of the maternal deaths. And this has guided our efforts to intensify capacity building through mentorship to the healthcare providers. Fifth, the rolled out multi-sectoral strategies, including the use of technology in nutrition assessment by procuring cobas machines. These machines have strengthened the capacity of our nation national laboratory to conduct a nutrition-related analysis, such as the use of biological samples to assess nutritional status. By using local expertise, we designed a modern local salt mixing machine that ensured adequate iodine levels. Collectively, these various interventions have increased the rate of wasting among children under the age of 5 from 4.5% in 2015 to 3% in 2022. Stunting among children under 5 has declined from 42 in 2015 to 30% and underweight has decreased from 16% to 12% over the same period. Here, we haven't done much good, but then it's a progress, and the journey continues. We are continuing to take required measures to continue reducing the underweight, the stunting, and the malnutrition. Fifth, we have been implementing a national accelerated action on investment agenda for adolescent health and well-being, focused on addressing teenage pregnancies and gender equality, empowering girls with education and life skills. These efforts provided tools needed for girls to make the right and informed choices and lead healthier lives. As a result, teenage pregnancy has decreased from 27% to 22%. Sixth, deployment of community health workers who have been instrumental by providing access to essential healthcare services at the grassroots level. The community health workers have served as a vital link between health facilities and communities, delivering critical health education and promoting immunization and nutrition programs. They also have contributed to the increase of awareness and addressing barriers such as traditional or cultural practices. Their role in preventive care, coupled with early detection and referrals, has not only reduced preventable deaths, but also strengthened community trust in health care system. Ladies and gentlemen, this progress has not been achieved in isolation. It is the result of collective actions. The unwavering dedication of our health workers, the partnership of civil society organizations like the Jakaya Kikwete Foundation and others, and the support of global allies like the Gates Foundation and others. However, much as we celebrate these achievements, we recognize that the journey is far from over. We still have work to do to further improve these metrics and improve health services. Additionally, other challenges such as climate change, regional outbreaks, and economic inequality remind us that our work must continue with renewed vigor. You may wish to note that this year we are finalizing implementation of our national development vision that covered the 25 years period from the year 2025 up to this, from the year 2000 up to this year 2025. And in it we had set to increase health and well-being of Tanzanians and to raise the life expectancy. I'm happy to note that since then, life expectancy rose from 51.5 years to 66 years in 2022. Over the next 25 years, we aim to further invest in health and increasing accessibility so as to raise the life expectancy at least up to 75 years. In this regard, we call for continued engagement with the Gates Foundation as we work to meet our health goals for our people. Ladies and gentlemen, it is my ambition to realize continued investment in specialized health facilities and services. One area where we see continued partnership is training and capacity building to ensure we address the shortage of qualified staff and specialized manpower. Tanzania's story is a testament to what is possible when we place health, nutrition, and equality at the forefront of our priorities. As a global community, we share responsibility to ensure that no woman, child, or adolescent is left behind. To my fellow leaders and policymakers in this room today, let this award inspire us to push the boundaries of what is achievable. Let us commit in investing in systems that uphold the dignity of every individual, ensuring that progress is sustainable and inclusive. Ladies and gentlemen, as I conclude my remarks, let me dedicate this award to all health workers whose compassion Thank you. To all health workers whose compassion, skills, and resilience made our efforts meaningful. Together, we continue to champion the global goals and ensuring that health remain a universal right. Thank you very much for your kind attention.